Please welcome Cynthia Bissett Germanotta, President and co-founder, Born This Way Foundation.
Good morning, everyone. Good morning. I share my deepest gratitude to Bloomberg Philanthropies for bringing us together to address the most urgent challenges of our time, including the mental health of our young people. An issue that intersects many topics spoken about today, and one that will take all of us working together across fields to address. As president and co-founder of Born This Way Foundation, I have the privilege of speaking with young people every single day. These conversations, along with the research we conduct, are the heartbeat of the mission of our work, which is to empower and inspire young people to build a kinder, braver world that supports their mental health. Today, I'd like to share the importance of what we've learned from young people directly and how their perspectives have helped shape our approach. Also, I heard there are over 300 fellows here today, so hello to all of you. We see you, we hear you, we validate you, we love you, and we can't wait to see what you do in the world. We're working very hard for you. Right now, younger generations are navigating an extraordinary, ever-changing set of pressures. They are keenly aware of the fact that this rapidly changing world, marked by economic instability, social inequities, and other factors, presents an uncertain future. Climate change, limitations on personal rights and freedoms, social media, all weigh heavily on young people, especially those from historically oppressed communities. While we recognize these changes, we're also witnessing something very hopeful. In light of all they're facing, young people are overwhelmingly aspirational and are not short on solutions. We need to ask, to listen, to offer support by giving them the skills, tools, and agency to shape the kinder, braver world they envision. Born This Way Foundation puts this awareness into action through three key approaches to keep young people at the center of shaping solutions. First, we center their voice directly in conversations about solutions. Young people are the experts of their own experiences and have actionable ideas for how to support their own community and one another. They don't just need our help, they need a seat at the table. We create regular opportunities to bring together young people and decision makers for open discussions about youth mental health. For example, earlier this year, we partnered with California Senator LaFonza Butler to host town halls, bringing together young local activists and educators, peers, nonprofit and business leaders, to share perspectives on mental health and the solutions that they would like to put into place. From integrating preventative mental health education and services in schools and communities, to leveraging technology to meet the needs of young people. Audrey Wang, a member of our Youth Advisory Board, 17 years old, talked about the need to include young people in the development of social media and other online resources. But she's not just asking to be included, she's making the change herself. After seeing how cyberbullying and social media were taking a toll on her peers, Audrey coded a platform called Effective Cookies, which inspires users to improve mental health through inclusivity and empathy, and has already reached thousands of users to date. Audrey is one of the many youth that remind us that young people don't just have ideas, they have solutions. Encouraging collaboration across sectors and uplifting the innovative ideas developed in spaces like these can directly shape programs and policies. Senator Butler went on to recruit her own Youth Advisory Council, which helped directly influence legislation aimed at addressing systemic mental health disparities in communities. So we center the youth voice. Secondly, we follow the data. You can't solve a problem if you're not talking to those directly affected by the problem. So research is at the heart of our work to ensure every aspect of our programming is evidence-based and informed by a deep understanding of the evolving youth mental health landscape. This year, we're partnering with researchers at Hope Labs and LGBTQ+ youth themselves to explore how online communities impact their mental well-being. Early findings show that LGBTQ+ young people, especially those in rural areas, feel safer and more supported in moderated, affirming online spaces where they can freely express their identities and connect with others who share their experiences. One young person surveyed shared, quote, "I live in a small village and there are not many gay people. Online, I have met several people who understand what I'm going through. It lets me connect with someone and not feel alone." As we examine this intersection between youth mental health and social media, having data on the actual experiences of youth, specifically online, is deeply important. The billions of young people globally are not having a singular experience with mental health. We need data that helps us understand these differences and craft solutions that are responsive to their broad range of needs. By combining research with youth input, we can design interventions that meet young people where they are and build resources they'll actually use. So we center youth. We rely on the data. And lastly, we dream global, but we think local. While national and global policies are critical, the best way to meet the immediate needs of young people often begins at the local level. Across the world, community organizations are already providing life-saving support to young people, whether it's direct mental health services, access to housing, food, mental health services, or just spaces where they simply feel safe and supported. Through Born This Way Foundation's Kindness in Community Fund, we invest in local and community-based organizations, helping them amplify and expand their work, collectively reaching even more young people with a broad spectrum of services, all while creating spaces of safety and belonging. Our current cohort of grantees spans 65 organizations in 10 countries. We've funded over 250. And we are very excited and proud about that. And one of the most exciting things is that we create relationships between these organizations so that they can network and share learnings. One of my favorite moments was hearing a young person describe how they finally felt seen when a local organization provided them with a safe space to share their struggles. It's a simple, profound reminder that community is at the heart of healing. Kindness is at the center of our work, and it isn't just an ideal. It's a tool for empowerment. My daughter, Stephanie, who many of you may know as Lady Gaga, but to me, she's my Steffi. She often says that kindness is a currency that we all have, and we should spend it freely on one another. Our research shows that young people in kind communities experience better health outcomes. Fostering environments of acceptance and understanding helps young people thrive. None of this at all can happen without collaboration. It will take all of us to be willing to not just work for young people, but to work with young people. This work is urgent, but it is also full of hope. When we stop assuming what young people need and simply ask them, we discover that they're already working to be part of the solution. Our role is to listen, amplify, resource, and together we can build a world where mental health is prioritized, communities are strengthened, and every young person has the opportunity to thrive. I thank you, Bloomberg Philanthropies, for shining the light on this important topic, and I thank each and every one of you for the great work that you're doing every day. Thank you so much.